Hi, everybody. I hope you're all online and joining us in this webinar to discuss limb lengthening and or height lengthening. So first of all, I'd just like to introduce myself. My name is Dr. Shahab Mahboubian. I am an orthopedic surgeon, and my specialty is in limb lengthening and deformity corrections. I am one of the very few doctors in the United States that perform cosmetic limb lengthening. And I do get a lot of questions regarding this surgery, and this is why I created this webinar so that you guys can understand what this surgery is about, what it entails, how to go about it. If you are interested, obviously you would be interested since you're here with us. But as far as how much you're interested in going forward with the procedure, after listening to my talk, you might be more inclined to proceed with the surgery. And then, like I said, if you have any other additional questions, you can either email me or ask me questions here, and I will provide you with my email address at the very end as well. So without any further ado, I would like to start on the presentation, which should take about 15 to 20 minutes. So I will sign off here and share the talk with you. So again, this talk is about the height lengthening procedure. So there's a lot of indications for this procedure, or actually other people can call it reasons for having this surgery. So first and foremost, this is a surgery to help with functional improvements. So people that are short, they have sometimes difficulty reaching high shelves, or even they have short legs so they can't drive. So it can be considered a functional improvement surgery. A lot of people get it because they just want the self-confidence. They have a lot of peers that are taller than them, or they have a constant barrage of being made fun of in public or in private because of their short height. So doing this procedure also brings about a lot of self-confidence. There's some that they just want to find or be in a relationship, and they feel that their height prevents them from finding a proper mate or being in a proper relationship. There are certain jobs that prefer people that are taller. So some jobs will not hire you due to your short stature. They may not tell you straight out, but that could be part of it. And in fact, there are a lot of studies that show people that are taller actually end up with higher salary jobs. And you could look that up, and there's plenty of evidence that shows things like even CEOs of many companies, most of them are 6 foot and above, because I guess people just look up to people that are taller. There is something that's called heightism, and if you look this up, this is like a discrimination towards people that are short. So people who have heightism or feel that they get discriminated against suffer through life, and this is another reason why they do this surgery. Patients that have achondroplasia or have dwarfism, their long bones in their body, including their arms and legs, are just naturally shorter. So this would be a surgery for them to gain better function. And then there's also cultural. So in certain cultures, there are people that look up to others that are taller, and that's really true in the United States as well as other countries. So people ask me, what is height lengthening? Well, this is a minimally invasive procedure that allows somebody to gain up to 8 centimeters of length from one single surgery. That's either lengthening the femurs or lengthening the tibias. However, if 8 centimeters, which is about equivalent of 3 inches, is not enough for you, well, you could do the procedure again on the other part of your leg, for an additional 8 centimeters. This potentially can give you up to 6 inches in height. Now, not everybody is able to gain the full 6 inches because of contractures and difficulties stretching out all the muscles and soft tissues, but potentially you can gain up to 6 inches. The procedure is done internally or externally. Of course, the internal method is usually the preferred method. However, external method is an alternative option, which we'll get into later on. The duration of the lengthening for the 8 centimeters is approximately 3 months, depending on how fast your bone grows. Some are longer, some are actually quicker. Then you need an additional 2 to 3 months of therapy and strengthening your legs so that you could walk and get back to full activities. So this is an example of a monolateral frame, which is an external device. As you can see, there are pins that are going from outside through the skin into the bone, and this allows the bone to grow without an internal rod inside. Now, of course, this doesn't really make much of a difference in the femur as it does in the tibia, and again, we'll get into that a little bit later as I explain some of the examples of my patients. The other problems with an external frame is that you have to do pin care, and you have to have all these supplies that you see in front of you every day, cleaning the pin size to prevent any pin track infections. And sometimes, no matter how good you are with your cleaning, you still get the infection. So it is a little cumbersome, but it is a viable option, and we'll go into it why later. So the more common technique nowadays all around the world is to do an internal limb lengthening. This technique is used for patients that have problems with limb length discrepancies, which were either due to trauma, tumor, or prior infections. They're also used for patients that have congenital short limbs, such as femoral deficiency or fibular hemimelia, as well as tibial hemimelia. But of course, here we're mostly concentrating on the cosmetic aspect of this surgery. So these are the two devices. Well, the picture you see is the Precice. This is the first generation of the Precice nails that came out, which you can see that it used to connect the two parts right over here. But this caused the nail to be very weak. So the Precice 2 came out with one solid nail, which is a lot stronger and less likely to break. And there have been even further improvements made to this nail that's even more stronger, that's even stronger now. The other nails included the ISKD, which has become obsolete by now because of too many problems with the nail. There's also other nails out there called the Albizia, the Betz bone, the Fit bone. These are only available outside of the US because they're not FDA approved for one reason or another. But we've been getting great results using the Precice system. So here's a video of how the Precice nail works in case you haven't seen this yet. So this is made for a tibial lengthening. So we make an incision right in the anterior aspect of the knee, spread the soft tissues, and then make a drill hole at the top of the tibia where the nail is going to go in from. We also do some reamings. Before we do the reamings, we actually make a few drill holes right here to allow additional stem cells from the bone to seed the outside of the bone so that it has enough stem cells while the lengthening is going on. So we cut the bone here, and then we pass the nail all the way across the osteotomy site down into the distal tibia. We then put in the screws to hold the nail in place. We also cut the fibula and also add an additional screw to keep the fibula together. Then we use this external device called the ERC, which over time about a millimeter a day. It lengthens the bone and new bone fills in. And usually about a year later, we take out the nail, and that's the end of the procedure. So, a lot of people ask me, so what are the complications and what do we need to look out for after this surgery? Well, first and foremost, the main reason why we do this surgery at the hospital is for compartment syndrome. And compartment syndrome is basically excess bleeding into your leg after the procedure. Now, I take every precaution to make sure that this doesn't happen, but sometimes no matter what you do, there's still a small chance of this happening, and this is the reason why you stay at the hospital. So signs of compartment syndrome include pain out of proportion, excessive swelling of the leg or the thigh. There's pain on passive stretch. If the compartment syndrome goes on for too long, you could get loss of nerve function and loss of pulses as well. So the nurses, always check for sensation, make sure there's motor function while you're at the hospital. And this usually needs to be monitored for about 48 hours. After 48 hours, you're pretty much in the clear. The recovery after the surgery, well, the company says for these Precice nails that you're only allowed to weight bear up to 75 pounds. However, because this is a telescopic nail and the inside of the nail comes out as you lengthen, these nails are fairly pretty strong and very stable at the beginning. So I actually have my patients fully weight bear initially so that they could get around and move around, and that actually helps stimulate the bone healing and actually helps with recovery and circulation. It's only after you've lengthened more than halfway where you have to go back to 75 pounds of weight bearing. So during this time, you need a walker for transfers as well as for short walks. You start therapy right after surgery, and you need to continue doing therapy for 4 to 5 times a week. Basically, the therapy is aimed at stretching and strengthening the legs. So, and this is the reason why I don't expect anybody to have to be close to the office. You can actually go home, and I'll write out a physical therapy note for you to have a therapist that's near you that could perform these exercises and teach you how to do these things on your own. So you just focus basically on stretching and strengthening. Vitamin D and calcium are essential to bone healing, so you start this right after surgery. You also start on DVT prophylaxis on the first day after surgery. DVT prophylaxis is basically blood thinners to prevent any blood clots from happening, but because that is a possible complication. You'll also be provided with pain medications. However, pain medications are mostly needed in the first couple of weeks. Because this is such a slow lengthening process, you usually don't need as much pain medications as the lengthening process proceeds. However, pain medications are always provided for you in case you need them. So other complications that can occur, we already discussed compartment syndrome. There's also a small chance of infection. Non-unions can occur, which that's basically if you lengthen too quickly, then the bone doesn't have enough time to catch up and fill in, which leads to a non-union. There's problems of joint contracture, so sometimes you can't lengthen too much because, for example, you can't straighten out your knee. You develop joint contractures. So again, therapy comes into play here a lot. Nerve damage is another possibility, and this is why I always monitor, and you need a continuous follow-up during the lengthening stage of this procedure. If you walk on these nails too much, you can get hardware failure, and that's basically when the nail breaks, and that's usually due to too much weight bearing for too long of a period of time. You can also get early consolidation. As you can see from this picture, this is the regenerative bone, and some people just make bone a lot faster than others. And if you don't lengthen fast enough, this bone can consolidate, preventing the nail from continuing to lengthen. And I've seen that happen. There are ways to get around it, but again, this is why it's important to come in for follow-up visits routinely. So I'd like to get into a few surgeries that I've done in the past and show you guys examples of how this exactly works. So this is a picture of a 32-year-old male from Hawaii. He was at 5'6" to start with, and he wanted to gain the full 8 centimeters. So this is his pictures right after surgery. As you can see, the nail is in, and this is where the bone was cut. And you can see on the outside, this is the reamings from the inside of the bone, which help seed the lengthening site. So 9 weeks postoperatively, he has gained 8 centimeters of length. And here he is, fully lengthened out, good bone forming on both sides. And he was moving and doing his therapy. He was very motivated and did very well. And this is him after lengthening. This is him about a year after his surgery when I was in Hawaii and we actually met up, and he was doing great. Here's another example of a tibial lengthening. So this I actually wanted to show you guys because this patient decided to undergo the external frame. And he still gained the 8 centimeters. And this is the frame on the outside, and these are his x-rays that show good bone formation, both for the fibula as well as for the tibia. So you might ask, well, why would anybody want to do this external frame when these internal Precice nails are available? Well, the problem is usually because of price. The external frames provide a little bit of a cheaper option to undergo this procedure. And again, this is a cosmetic procedure, so the surgery fees and the hospital fees and the cost of these implants have to be paid for. And it can be quite expensive, but the nails are a lot more expensive compared to these external frames. Now, not to say that these external frames aren't expensive, they still have a cost, however, it is the cheaper option. Now, there are a lot of females that come to me that also want to get taller, and people say, well, you know, isn't this mostly for men? That is true. Mostly men are the ones that get affected by heightism, because they're the ones that usually get discriminated against. However, there are a lot of females that want to be taller too. So this is an example of a 26-year-old female. She was at 5'4" in the military. However, you know, she felt that she was a lot shorter compared to her peers. So she wanted to gain at least 2 inches, and that was really her goal, just to feel normal and at the right height that she should be at. So after undergoing the procedure, she was at 5'6". She started at 5'4", and after only 2.5 months from surgery, she was walking without any assistive devices and walking without any pain. These are her x-rays. You could see she developed bone very quickly and very strong, and she was very happy. And this is her afterwards, standing very confident and very happy with her results. So that's the end of my presentation. As you can see, this is a procedure that's slowly becoming more and more popular. I think it's very important for everybody to have as much information as possible before undertaking such a life-changing procedure. Okay, so I want to go through the questions. I see there are a few people that have asked a question. So I have a question asking, to do this surgery is to be subtle and to be inconspicuous. Will scars show up? If others can find out, then there is no point. This is a concern that many people have. This procedure is still somewhat considered taboo, and a lot of people don't want others to know that they have undergone such an extreme procedure. And so I do understand. And actually, the scars that are formed from this internal procedure are very, very minimal. Like I said, it's a minimally invasive procedure. There will be little small scars, but very invisible to the naked eye. It helps if you're a man, because men have hairy legs usually, and that also helps to cover up the scars as well. Another question I have from Howard: why would you operate on the femur versus the tibia? Very good question. I always encourage my patients to initially start with the femurs. There's multiple reasons why I would prefer to do the femurs. Number one being that it's a much easier process for you as a patient to go through. The recovery time is a lot faster. There's much less complications. You're up and walking a lot better. It's just an easier procedure for you to handle. When doing the tibias, I would do the tibias as a second procedure. So if you ever wanted to do both procedures, I would always start with the femur, then the tibias. Because by the time you get to the tibias, then you're more of a pro. You know what to expect. You know how to get around. It's just makes it a lot easier. And the reason why the tibia is a little bit more difficult is because there are more complications with the tibia, including a higher chance of compartment syndrome. But in addition, it's just a much slower process because the bone in the tibias just don't form the regenerate bone fast enough. So it takes almost twice as long to get the same results as you do with the femurs. I hope that answers your question. Let's go to the next question. What's the procedure if you experience non-union? Well, there's several ways to deal with non-unions. One is you can, the nice thing about these nails is that you can actually shorten the leg. So if you distracted too quickly and didn't form a bone, you can actually compress the bone back together and then slowly lengthen it out. Other things that we do are make sure that you're taking your vitamin D and calcium. We can add a bone stimulator to your leg, which you'll be using on your own. There's also the possibility of doing a stem cell injection, which tends to really help stimulate the bone to regrow again. So there are a lot of different ways of handling these complications, and this is what I've been trained for to do. All right. Next question. Out of 10, how many people are able to gain full 8 centimeters? This is really a individualized basis. I could say all 10 can gain the 8 centimeters. I could say 0 people can gain 8 centimeters. It's very, very individualized, and there's no way of knowing for sure until you actually do the surgery. Now, out of the 100+ patients that I've performed this procedure on, I would say 90% of them have gained their goals. Now, mind you, not everybody's goal is to gain 8 centimeters. As I showed you the example of the one lady, she only wanted to get 5 centimeters of length, and she was able to gain that without any problems. But it really depends on what your body can handle. And doing the proper therapy, you should have no issues gaining the full 8 centimeters. Okay, next question here. Whenever I tiptoe and gain 3 inches, I feel the legs become so long in comparison to the torso that it's out of proportion. Would 2 inches be better to gain? We must balance being taller with appearing in similar proportions as before. A lot of people have a concern about proportions, as you should. Now, one of the reasons why this nail only lengthens to 8 centimeters is to keep the proportions from going out of control. 3 inches in one segment is not really going to throw off your proportions throughout your body. It's really not. You function just fine. People, if you wear really, really short shorts, can tell that you've had something done, but they can't really pinpoint it. And then if you wear pants or even longer shorts, there's no way for them to tell, because again, it's not that obvious that you've had something done, and your proportions are not going to be off to the average person. And as far as function goes, you're able to function just fine. It's people that usually go above the 8 centimeters where you start noticing where you start noticing the difference in the proportions. Next question asks, is there a psychological testing requirement, or would you operate on anyone? Tell you honestly, I used to do a psychological testing on everybody at the beginning of my career, but I've come to see that not one person has been rejected for any psychological issues. And again, that kind of plays into heightism, for example, because heightism does cause a psychological problem in patients that are shorter than average. And even patients that are above average also have this heightism because they just feel they need to be at a certain height to function normally. So I've kind of made my decision on individuals whether or not they need a psychological clearance, and that's usually pretty apparent when you come in for a consultation. If I feel uncomfortable, then I would have a psychological eval done. So it's not a requirement, but it is preferred to have one. It doesn't hurt, in other words. Okay. Next question. I am already 5'9", depending on time of the day. But the problem is that it is below average where I live in the USA, I feel. Is that too tall to get the surgery? We used to put a limit on who gets the surgery. After talking to other specialists that do what I do, it does not seem fair to limit this to others that are average height or even slightly above average height to not have the opportunity to undergo this procedure. Because like I said, even patients that are tall can have that heightism problem. It really depends on your peers and your family members and others that are around you. So you make a good point that you say, you feel shorter than others that are around you. So no, I would not limit this to anyone per se, but again, this is something that's individualized, and we will need to discuss it in further detail to see if this procedure is right for you or not. And that's why a consultation is mandatory for you to come in to discuss these issues so we could plan the best treatment or course of treatment for you. Okay, this is going to be the last question. Are there any chances that the Precice technology may become cheaper in the future? I really don't know. So far, as I've seen it in the past 3-4 years that the Precice has come out, the price has actually gone up. And I think the price is going to continue to go up because everything in medicine and everything in the world, usually the price goes higher as economies improve. So no, I don't see this procedure or the Precice system getting any cheaper in the future. I think more than likely it will be more expensive. So I hope that answers that question. If you guys have any other questions, please feel free to email me. You could reach me at info, I hope you're writing this down, it's info@laorthopedics.com. I'll spell it out again, info, I-N-F-O, at LAORTHOPEDICS, orthopedics, so laorthopedics.com. And you could reach me through email. And if you have additional questions about setting up appointments, you could call my office to set up your appointment. You could reach me, or you could find my number on my website, or I can give it to you now, which is 818-322-0126. Please visit my website at laorthopedics.com, and there's a lot more information on there as well that you can go to, and again, you could email me through that website as well. I'll take one last question, and then we'll cut it off here. It says, would we have the opportunity to talk with some of your patients? Absolutely. I always put potential patients in touch with my prior patients, because it really helps to talk to somebody that's been through this process and can share a lot of information of how to make this process as least painful as possible, and what to expect, how to get around, what supplements to take, and so on and so forth. Now, of course, I will be able to provide most of that information for you, but absolutely I can put you in touch, but only once you have come in for your consultation, and I know that you are serious about the procedure, and then I will provide you with their information, because of course everything is confidential. So I hope this was a helpful webinar for you guys. And again, any other questions, please do not hesitate to contact me through email. Thank you very much. Have a good night.